I'm Dr. Mark Socinski. I'm the Executive Medical Director of the Advent Health Cancer Institute in Orlando, Florida. I'm also an active member of the Institute's Thoracic Oncology program. I've got several of them. The one that comes immediately to mind is a gentleman that I met, had to be coming up on 4 years. He was a young guy in his late 30s. He was a smoker. Actually presented with seizures to a neighboring hospital, was found to have several metastatic deposits in his brain. One of them was resected and found to be adenocarcinoma of the lung. He also had multiple kind of cavitary lung lesions and therefore had stage 4 disease. He had an adenocarcinoma. He did not have an oncogenic driver. Actually, I take that back. He might, if I remember correctly, he might have been KRAS positive now that I think about it, but certainly none of the actionable oncogenic drivers. He recovered from his craniotomy. He came to see us at the time. His PD-L1 expression was about 80%. We had a clinical trial at that time that was looking at the role of assessing blood-based tumor mutation burden. It was called the BEFIRST trial. It therapeutically gave single agent atezolizumab. He enrolled on that trial and was treated with single agent atezolizumab. He had a very nice response. He ran into trouble with hypopituitarism manifested as adrenal insufficiency. He was replaced with steroids. Interestingly, he's never had a thyroid issue in that setting. The protocol called for 2 years of therapy. He received 2 years of therapy. He has been off therapy for almost 2 years. And we are scanning him every 3 months. And his brain is clear of disease, just some residual effects of the craniotomy. And his chest has shown a major regression in all of his cavitary lesions. He still has some residual scarring there, but that has remained clinically stable now, off therapy for coming up on 2 years. This gentleman is now about 43 years old and living his life. And so we used to never think that stage 4 lung cancer was curable. And I don't think it is with standard chemotherapy approaches, but the ability to induce a significant immune response is a different story. And I think that if you can induce your immune system, remember, if you put a mismatched organ in a patient, it has the capability of destroying and rejecting that organ. So the immune system is very powerful. And I think much like it would reject an organ, I think it also has the ability to reject tumors in patients. And this gentleman so far has been a super responder. He's done very well. And the great thing about it is that he's been off therapy for almost 2 years and really not showing any signs of recovering or recurring to date.